Hedge End Medical Centre is in West Hampshire CCG. We've got a list size of about 14,000 patients. We've got 7 partners and a variety of admin and other clinical staff.
We had the challenges that affect every GP practice in the country, trying to manage our on-the-day or acute care demand. One of the things that became obvious to us, and me particularly, was we needed to adopt technology to support that.
eConsult is a way of triaging patients. It helps manage on-day demand so that the right people are getting into the right appointments. They go onto our website and they go through and answer a series of questions. There's a list of around 100 conditions, so for example migraine, hay fever, chest pain, all of those sorts of things. They choose whatever's most appropriate, and the tool will actually ask the same questions that a clinician would ask, so you can be confident that the answers that the patient has given are the same ones that they'd get to the clinician, and therefore they'd end up with either your symptoms are too serious to continue with this tool, in which case the patients are told what to do, whether to go to A&E, or if the symptoms aren't serious, then they finish the assessment and the information sent to us. So in that way, the patient and our clinicians have confidence that the people who are coming through to us are the right people.
That's the critical purpose of eConsult, as I see it, is to make sure that the people who need to see a clinician can see a clinician in a timely way. We spend a lot of our time seeing patients who don't need to be seen, and they don't want to be here. By pushing people down the eConsult route, a certain amount of patients are going to look at that information available through the eConsult process and are going to be able to manage themselves. And that's the best outcome, a patient who no longer needs to get advice from a professional. Once you've got to the point where professional input is needed, the structured format of eConsult allows the clinician to quickly understand what the problem is, and really importantly, the first critical question patients are asked is, what do you want to achieve from this consultation? And that's really important because that allows you to understand really quickly what's happening, and because they're not sitting in a consultation feeling they're under pressure, they can think about actually what they really want to achieve from it. So you immediately get a good background. And the structure of the report highlights potentially red flags or important pieces of the history, so you can focus in on that quickly. And effectively it allows you to have a much more efficient consultation, I find.
When we brought it in, it was myself as a manager and also one of our clinicians who started implementation. It really does need a clinician to have enthusiasm about it and to lead it from the clinical team point of view, because it's all very well me being excited about it, but it's affecting their workload.
The critical thing in convincing my partners was to convince them that it wasn't going to make their life more difficult. Whenever you introduce new ways for people to access services, there's always a concern that that's going to drive demand. So we went in by saying, you won't be doing more work as a result of this. In fact, you're going to be doing less, because this is going to make the demand more manageable.
The biggest difficulty was for the admin team because it was a complete change of how we were running the front end of the system. So they had a new script to say to the patients and they had to sell a new product to them.
I did wonder how some of the older patients and things that aren't so used to internet and things would take to it. So we did have concerns we'd have more queries and upset patients in that sense, but it has really worked. They've adjusted far better than what we thought.
I do feel confident that using it, that you're going to get the answers that you want, or more to the point that you have some point of contact after hours and as soon as possible when they pick up the email from you. So far they've always rung me very early the next morning, either to offer an appointment or to offer some advice, which has been very useful.
It's very easy to look back with a rosy glow at what used to be, but in actual fact, I think this practice has got better, and they've harnessed e-commerce and other things in what I consider to be an excellent way, and this is just another tool that they've brought to play in that progression, which I think is good. It's a way forward. If I needed to see a doctor, I would use it. I wouldn't think twice about doing that.
The tool has gone through indemnity, So the Hurley Group and then EMIS have made the tool robust in terms of the questions it asks. So what you have to do as a practice is decide how the process is managed once the information gets to you. The way we've set it up is that it initially goes to an administrator who takes out anything that's purely administrative. Everything else, the way the indemnity works is you have to have a clinician look at the information before the end of the next working day. That doesn't necessarily mean they have to see someone by the end of the next working day, but they have to have seen it and decided whether the information in there needs urgent attention. In our practice, what we do is we tend to bring everyone either in or give them a phone call from a clinician by the end of the next working day. But that's just how we've decided to use it. It's what works for us, it's not the same for every practice.
The IT solution itself is very straightforward to implement. There's no technical issues really to get through. It's simply a link added to your home page of your own website. We wanted to make it front and centre, so in our web page it's right front and centre. It's easily the largest thing you can click on because we wanted it to make it easy for people to use. But the technical solution isn't difficult at all, and then you're receiving the messages via the equivalent of an email PDF type file. So it's very straightforward to introduce technically.
It was a lot of money, so it was a big investment to bring into the practice. The initial outlay was round about the cost of a salaried GP session per year. So our aim was to save that many appointments per week. For us that's around 18, but that might vary by practice. So we wanted to save 18 appointments a week, and we saw that figure gradually increasing over the first year. So the initial outlay was a gamble, but we gave it until the end of the first year to see if we were saving those 18 appointments per week. By the end of the first year we were saving just over that. Currently we're saving about 4 times what the initial investment was. So for us it's paid back in spades.